Hello everybody and my dear teacher. Today we're going to talk about the neonatal resuscitation management. And for this we're going to need our little patient. But first we must suppose that the activation of the EMS and the sense safety is already done. So first we start with the initial stabilization where we keep our little patient warm and dry. For this, we must dry him, and we can keep him warm with saline solution already warm in a microwave, or just giving the baby to the mother, because with the chest of the mother, the baby is going to feel so much better, and maybe just with those steps, the baby is going to react well. Well, after this, we must check the airway, the breathing, and circulation of the baby. For this, we must keep the neck in a neutral or slightly extended position, because remember that in relation with the head and the body of the baby got a bigger head. For this, we must keep a slightly extended position of the neck. After this, we must suck out the secretions with a bulb. With a bulb, we can suck out all the secretions of the baby, and this way, and we clear the airway this way. After this, we must check the heart rate, and the easiest way to check the heart rate is with the umbilical cord, because remember, the umbilical cord got a vein and two arteries. So this is the easiest way for us to check the heart rate. But in the worst case, if our patient is in apnea or with a respiratory rate lower than 100, we must start with chest compressions, and for this we supply positive pressure ventilation with a back mask. And remember that the oxygen must be humidified for this, or we can hurt the airway of the baby. And if the heart rate is lower than 60, we must supply 30 seconds of positive pressure ventilation with chest compressions. And if in the worst of the cases, if our baby doesn't react, if our little patient doesn't react, we must intubate to our little patient. And with this, if our little patient doesn't react, we must supply epinephrine. We must supply epinephrine. And remember that the intubation for meconium is no longer recommended. So if the baby got meconium, is no longer recommended to intubate. And if our baby is losing blood or has lost blood, we must supply saline solution or blood. That is even better. Well,